So here are some of the challenges. Number one, behavioral problems. The need for supervision. They always have to have somebody watching them, but most of them do. Isolation. And just limited abilities. I'm sure you probably have some interactions with dementia patients, so you can probably attest to most of this. But it's a high stress, high energy, it takes a lot of energy to care for this population. And because of it, you'll see more ailments within the caregivers or the family that include physical ailments, high blood pressure or mild hypertension, and they're more vulnerable to chronic diseases just because it takes so much energy out of them to care for dementia patients that it leaves them open to other types of diseases and sicknesses. Have you ever been so busy that it compromises your immune system and you find yourself getting more sick? It's kind of very similar to this. Because it takes so much out of a person to care for someone with Alzheimer's or dementia, they are more susceptible to disease and other sicknesses. And right here it says that caregivers succumb to life-threatening illnesses at a higher rate than those who do not care for somebody. So it's pretty serious. So here's some of the options for family members, some things they can do. Adult daycare. I've talked to you about how this is something my grandmother does religiously every day, Monday through Friday. But it's a great option for caregivers because it allows them to drop them off. Some daycares will have a shuttle that comes to pick them up, which is the option that my grandmother does. So the caregiver doesn't even have to worry about dropping them off. And then they go, and it gives them stimulation throughout the day. They do all different types of activity, arts and crafts, bingo. They feed them. Sometimes they have speakers come in. So she's talked to me about them having an attorney come in to talk to them about preparing a will. So they do all different types of stuff at adult daycare. So this is one option. And it also helps them, in addition to giving relief to the caregiver, it gives that patient or that resident some mental stimulation, and they're able to be around other people, so they get to have some socialization going on. So it's a good option. Next option, assisted living. We saw at our visit that they had a wing or a floor for assisted living, right? Now, what she didn't mention, and nobody asked, including me, was if any of those were dementia patients, which we could have asked, but we didn't, we forgot. But this is an option. Assisted living, this is probably an option for caregivers who just either don't have the time or the energy to do it themselves. So they take this option.
But can they live by themselves?
Well, they'll be in an assisted living facility, so they'll have, there's some people with dementia that can completely function. They can bathe themselves, they can feed themselves, they can function. They just really can't remember anything. You know what I mean?
Right.
So it kind of goes back to when Ms. Thompson was talking about the assessment that she does. It goes back to that assessment, and at that point they will assess probably if they're capable of being an assisted living candidate or not. Because there will be some dementia patients that just they can't remember if they took a bath. You know what I mean?
They can't leave them in the room by themselves.
Right. So it will depend on how their assessment falls out and what they're capable of doing. Good question. Long-term care. Obviously, we know that there's dementia patients in nursing homes and skilled facilities, skilled nursing facilities. So this is another option. And obviously, we know in this particular option, they're pretty much cared for around the clock. So assisted living, they have a little bit of freedom. They can have a little bit of independence, but here, they're probably, if they're a dementia patient in long-term care, they're probably have had it for maybe years, or they're down the road as far as what their stage is, and they really can't do anything for themselves. So this one comes up a lot: family versus professional caregivers. We'll stop here and we'll pose the question: if you have a family member that has dementia or Alzheimer's, what's your choice going to be? You're going to care for them, or you're going to hire a professional caregiver?
Professional caregiver.
Professional. She's on the fence.
I have a personal thing for this because my grandma was like that.
Okay.
And well, she had 10, my daddy had 10 brothers and sisters, so there really was no reason, because somebody was
Chip in.
always there.
Okay. So you think it could depend on the familial status or situation? Okay, all right. Well, there's some family that may want to keep them in-house and may not want to take them.
I mean, I keep them in the house, I just have like when I'm gone, like maybe a home health aide. and
Right.
stuff like-
But maybe they can't get it covered and they can't afford it. Or sometimes it's not always the caregiver. Sometimes it's the patient, and they're like, I don't want Susie
nobody.
Q coming in. You know, I only want my daughter or my son to take care of me.
Right.
So this is a common issue that happens. As it says here, again, go back to the level of emotional attachment. Maybe they're just really, really attached to their family. And at that age, they don't want somebody new coming in. So this is something that's often discussed. And in some instances, it'll start out being family, and then they're like, I can't do it anymore, and it'll change to caregiver or vice versa. So this is a common topic. In your chapter, it talks about a few different studies that have been done on dementia care. I'm not going to go into the studies too much, but I'll basically say that in one study that was done in 2001, they found that the stress related to caring for dementia patients had a significant impact on the behaviors of the staff towards the patients. So does that make sense? Have you seen any of that occur? Okay. And so basically, we talked about the fact there being a lot of lawsuits. Somebody might try to use this study in court. Why would they use this study in court? Think about if there was a case that dealt with negligence or abuse. How might they use this study?
The study could back up the statement that they're making or the case that they're trying to make.
Absolutely. They could say, well, I was so stressed out because of this dementia patient that it caused me to forget to turn Miss Thompson, or flip, or change the bedpan for Mr. Wilson or whatever. So there's a lot of research going on related to stress and how it's linked to dementia care. Here's some more information from the studies. Less time, 1 to 3 years in long-term dementia care is associated with stress. So basically what this is saying is that the newer staff, the people that are new to caring for dementia patients usually have more stress, which is pretty self-explanatory because they're not used to it, right? If they don't have enough training, it may also increase their stress. And then it always comes back, right?
Okay.
Money. A lot of them feel like what they're being paid doesn't match the tasks and the stress that they have to endure working with dementia patients.
I agree.
Okay, I figured you would say that. All right. Here's some perceptions. The book says that they may have negative perceptions of those living with dementia. Why might that be the case? Why would they have negative perceptions about those with dementia?
Because it may make some demands that are just completely unreasonable, just
Okay.
out of the world.
So, unreasonable demands. Anything else?
Behavior.
Behavior.
Feeling their behavior.
Yeah, fear. So
Fear.
fear of their behavior, which is understandable because,
They're hard to deal with.
yeah.
They're
So there's a lot of these overarching negative perceptions that probably only adds to the stress. If they have these negative perceptions, they're almost planting seeds in their minds before something's even happened, right? And then it says that you have some nurses that will have positive perceptions, positive aspects of giving care. They take pride in the things that they do and being proud of the fact that they're helping someone that's basically helpless. And so those nurses that take pride are the ones that are committed and have a commitment to the care. Another study was done about nursing professionals or long-term care professionals that are committed to their job. They found that 50% were considering another job, but 75% were planning to stay. So yes, you will have some people that are burned out and have negative perceptions, but all in all, if you get into dementia care, most people are there because they want to be there. So that's a good thing to know. Turnover. We've already talked about turnover a little bit and how high it is in a long-term care setting. Do you think that it's higher with dementia care or lower?
Higher.
I think
It's higher. Everybody thinks it's higher. It's pretty high. If you look at these numbers right here, you can see that's pretty high turnover. And even down to the administrator. Even for an administrator, that's pretty high.
I used to work at a VA hospital,
Mm-hmm.
and I spoke to the manager there,
Mm-hmm.
and he told me that he wanted me to work on the dementia ward.
Mm-hmm.
And I thought it was the best thing ever, to draw blood. And my first day, I mean, I thought I was gonna go crazy. The first thing they just started yelling that, you know, about their veins. And I'm like, it's okay. You know, first you have to really talk to them, because you would tell them why you're here, why you gotta draw the blood, and then just as you're about to be right beside it, go ahead and touch it. And you already asked them not to touch that site after you already
Right,
clean it. And they touch it and they will ask, why are you doing it? You already explained it to them. Then you explain yourself like 5 times because they don't remember
Right.
what you just said to them.
Right.
And the needle being there and they're trying to yank it out their arm. So it's not, I could see, when I came back, everybody just started laughing. It's like, oh, you made it through. I was like, what would have sent me there?
So it's pretty stressful.
It was very, very stressful.
Yeah.
And you always have to, well, for me, I was so scared because you don't want that needle to be in their arm and they're moving around and fidgeting, because you going fishing and now they're pulling that needle out of their arm. You gotta be very, very careful,
Yeah.
you know. So it's best if I find out before I go on hand what these tests are, maybe I could just use 1 tube to run that 2 tests instead of having to do 2 tubes, because when you're
Right.
switching, and while you're trying to switch those tubes, they're already trying to yank it out of their arm because
Right.
they're like, I don't need this. I don't want this.
Right.
So it was very, very stressful for me.
Okay. All right. Any other comments? Thank you for providing a good example. So obviously we know turnover is not a good thing, and we also know it's directly related to care. If we, are running a facility and we have our LPNs, our RNs, our CNAs, and everybody's turning over, are we creating any type of continuum of care for our residents or our patients? No, right? Because they're constantly seeing new people.
Yeah.
And especially if we think in terms of dementia care, if we're lucky enough to have a patient that does remember us and then we leave, it's not a good thing, right? So turnover is very important as it relates to care. Has a big impact on it. We talked about stress, reasons for burnout. We pretty much already talked about that. Workload. Help me out here. I'm not clinical, so how many patients, dementia care patients, would you say a person can reasonably handle?
Yeah, I say 2, because, I mean, we have wander guards, so it'll go off if they, leave from us or from wherever they're supposed to be at, so, but 2, no more than 2.
So 2 dementia patients in addition to other patients, or just 2 period?
Just 2 period, because you can't take care of 2 dementia patients plus have a, assignment.
But that's probably not usually the case, right?
Right.
They have more than that. And
Yeah.
so workload in most cases they're probably overworked.
Yeah.
They have too many patients to adequately care for the patients, including the ones with dementia.
They usually bring in sitters for those, like, people to come and sit with them for
Right.
3 hours.
Yeah, okay. And they get paid, right?
Yeah, they get paid.
Okay.
From a separate company.
Oh, separate companies,
Oh,
like
yeah.
staffing.
Yeah.
Okay. All right. Thanks, Candace. Let's see. All right, so we'll talk about 6 recommended practices. These are the 6 practices that they recommend to cut down on the turnover and to make sure that you have the right people in place to care for the dementia patients. Number 1 is hiring right. How do we hire right? What do we look for when we're hiring somebody to care for dementia?
Experience.
The skill,
Experience,
the skill, the training.
training, skills.
I feel like in this field, the experience should, I mean, yes, it should matter, but you should see if the person has a passion. Because yes, they can have the experience, but your turnover is going to be high. But if they have the passion and want to be in this, then they will stay with you.
Okay, so
I feel
passion,
like, yeah.
Patience?
patience. Okay. Okay, and all those things are good, but if we're in an interview room,
How are you gonna know they have the passion?
how are we gonna interview for it?
You're gonna look for, I would go for people who have dealt with this situation before, so maybe the experience. Because I mean, people can say, oh yes, I have the passion for this and I have, but have you ever worked in that department before to know that it's very, very stressful?
Right.
How do you handle stress? Or not even say the experience to deal with this patient, but have you been in a situation where you worked in a very stressful environment and how did you deal with it?
Okay. So you'd ask them questions about stressful environments.
Right.
Can we add, are there any questions that we can ask that will detect passion?
You could give them like a work interview, like, what is it called? Where you have like I've gone on it before, where you go in and you actually do the work for a day, and that's the
Okay.
interview process still, like you're not hired.
Okay.
And you could kind of see too, like if the person has the passion.
So you wanna observe them. Okay.
Right, exactly.
What about patience? Can we interview for patience? Some of you guys have probably been interviewed for patience and didn't know it.
Probably.
Some of yes and some of no.
Have you ever went in for an interview and they weren't ready
Mm-hmm.
and you were waiting?
Mm-hmm.
They could have been on purpose. They want to see how patient you are and how you react to them being late. So anyway, so those are all good answers. But number 1 is hiring right, and it's probably the most important one because we want to make sure that we bring in the right people. Next one, providing appropriate orientation. Goes back to training. So as an alternative, if we don't have the opportunity to observe them before we hire them, maybe we give them a conditional hiring and say by the end of your orientation period, we'll see if we want to keep you on permanently or something like that. Nonetheless, we want to make sure that we provide them with all the orientation that they need to do the job and do the job well. Routine staff meetings. What did she say about staff meetings?
They're held every morning.
Every morning, right?
Mm-hmm.
So routine staff meetings is helpful to kind of talk about what happened yesterday, what are we going to do today. Maybe Mr. Wilson was very erratic yesterday.
Maybe there's something you could help out with that employee.
Right.
Because of what she went through yesterday.
Right, right. Or maybe you can say, you know, Tanya, we know you had a bad day yesterday with Ms. Jackson. We're going to switch you today so you get a little break and we'll have, you know, so staff meetings are important. Rewards, frequently.
Going back to that group assignment we did, we got B to do. When it says the frequent rewards,
Or the popcorn break.
incentives, yeah, we're gonna take away the popcorn and all that break, but you know, those staffs were happy.
Right,
The turnovers were low.
right.
So doing the frequent rewards thing is very good.
Okay. All right, creating a fun environment to work in.
Yeah.
Do you feel like the environment where we went was fun?
For the patients, yes.
No, I'm talking about the employees.
right now?
No, I seen all them nasals faced off, balled up. And then I said, excuse me, I was paying attention.
They
to
were a
all
little
that.
grumpy to
Yeah,
me.
they
They
were.
were just like,
Just
"Why
really
can't I get
grumpy.
over there?" You know?
So not a fun environment.
Yeah.
Mm-mm.
Okay. Did you see anything on the workstations?
Nursing stations?
Mm-hmm.
I saw like drinks where they can come up and get the refreshments.
Okay, all right. So little, but something. They don't have to go to the snack machine. They can get free punch right there. Last thing, conducting staff surveys. What do you think?
Yep. So if there's something that needs to be improved, at least the staff have that opportunity to.
Right. And I think this one should be regularly too.
Yes, I
Maybe
think so.
quarterly. And definitely not annually, because we want to hear from the staff more than once a year.
Mhm.
So these are the recommended practices that they say will aid in keeping the turnover low. Kind of what I talked about, kind of what Chanel talked about, having that passion. You have to love them to be there. If you don't love what you're doing, especially as it relates to dementia care, you won't last long. So you have to love it. This is a diagram from your book. Basically, it goes through the things that are related to dementia care experiences. So it talks about relationships, best experiences, worst experiences, coping strategies, stressors, most satisfying, and abilities and traits. And it's based on experience, value, perceptions, use. So it's a pretty good diagram. If you have a chance, take a closer look at it in your book. And I think I'm going to stop here to run out of time. Does anybody have any more questions or comments about dementia care, dementia patients? There is, I know for sure there's at least one. There's probably more, but I know for sure there's one place here that is a dementia care facility. It's not very big. I saw it out by Methodist. So, you know, if any of you guys think this is something that you have a passion for, that might be a place that you just go take a visit at and see how it is, and check it out. Any other comments?